begin the assessment, I'm going to start with some hand hygiene by using some hand sanitizer. I'm going to be wiping down my stethoscope with an alcohol wipe. And I'm also going to be donning some gloves. Hi, my name's Tina and I'm your student nurse doing your head, eyes, and neck assessment. I'm going to be touching your face, head, and your neck. Is that all right?
Yes.
All right, and can I just have your name?
Sarah.
And your age?
18.
Perfect. And before we begin, Sarah, can I do anything to help make you more comfortable? Do you need to maybe use the washroom or anything?
No.
All right, so I'm going to be providing the patient with some privacy, and I'm just going to be asking you a couple questions about your symptoms. So the patient came in, they said they had a rash on their face and on their neck, watering and itching of the eyes, as well as a throbbing headache after waking up for a couple mornings. All right, so the rash on your face and your neck, how long would you say it's been there?
A couple days.
All right, and have you ever had a rash like this, whether on your face or the rest of your body before?
No.
Okay, and the itching and watering of your eyes, did those two symptoms occur at the same time or different times?
Around the same time.
Okay, and do you have any allergies?
No.
All right, no allergies. And lastly, do you know if anyone in your family has experienced any symptoms like the itching and the watering of the eyes, or the throbbing headache, or the rash?
Not that I know.
Okay, perfect. So we can begin with the general survey. So the patient appears to be their stated age of 18 years old. Their skin color is all one tone except for the rash on their face and on their neck. The patient's height and build is all appropriate for their age. Their posture is nice and straight. There does not seem to be any physical deformities or abnormalities that I can see. And so the patient's behavior, their mood is good. They seem happy and content. When I'm speaking with them, they are engaged and they're looking at me, and they're also dressed appropriately for their age. So can you just stand up and walk back and forth? You can sit back down. Alright, so while the patient did this, I was just assessing their gait. Their gait is normal, there's no wobbling or trouble walking. I've also been assessing their work of breathing. The patient does not seem to have any distress with their breathing, any heavy breathing or shallow breathing. Alright, and lastly, do you know what today's date is?
February 12th.
And do you know the reason you're here?
For a health assessment.
Alright, so the patient is alert and oriented to the place, time, and person, and their speech is normal and they're talking with me, they're not slurring their words or anything like that. So we're going to begin with the head assessment. I'm just going to be palpating your head. Let me know if you feel any pain. Alright, did you feel any pain?
No.
Alright, so the patient did not feel any pain when I was palpating their head. I did not see or touch any bruises, lumps, bumps, swelling, anything like that, or lacerations. I'm also going to be checking the patient's hair. Alright, so the patient's hair is all one thickness, which is good. There is even distribution around the head of hair, and it's all the same color, which is brown, and I could not see any foreign infestations, such as lice or anything like that. And so I'm just going to be palpating the face. And while I was doing that, did you feel any pain?
No.
Alright, so the patient does not have any pain in the face. All their facial features seem to be symmetrical. There is no edema. The patient's skin temperature is normal. The only abnormal thing is the rash on their face and on their neck. So last, I'm just going to be testing the patient's cranial nerve 7, which is their facial nerve. So I'm going to ask you to do a couple facial expressions. Can you smile? Show your teeth? Frown? Lift your eyebrows? Close your eyes really tight and puff out your cheeks. So while the patient was doing this, their facial features were all symmetrical. And so now we can assess the eyes. So first I'm just going to assess the external structures. So the eyebrow and eyelash distribution of the patient is normal and full. Alright, the sclera is nice and white and a little glossy, and the conjunctiva is pink. I did notice a little bit of watering, but other than that, no discharge or crusting. And so next I'm just going to be assessing your pupils. Alright, so the patient's pupils are 5 millimeters, which is in the normal range. They're both round and circular, so that and they are both symmetrical. And now I'm just going to be shining this light in each of your pupils, so just look straight ahead. Alright. Alright, so both pupils dilated to about 2 to 3 millimeters, which is normal. And now I'm just going to be checking the patient's accommodation. So I'm going to put the pen light 14 inches from your face and just focus on it as it goes towards your nose and then goes back out. All right, so the patient's eyes did accommodate well to the pen light. They sort of crossed as the pen light came closer and then straightened back out as the pen light came out. And lastly, I'm just going to be assessing the lymph nodes. All right, so we have the pre-auricular, the post-auricular, the occipital, the jugulo-digastric, which is also the tonsillar, submandibular, submental, the superficial cervical, the posterior cervical, the supraclavicular, and then the deep cervical. And that is it for the assessment.